October is Breast Cancer Awareness Month, a disease that 1 in 8 women will develop in their lifetime.
Well, this month we'll be taking a closer look at various aspects of breast cancer. Tonight, our Dr. Frank McGeorge is here with new research on an effective way to both reduce your risk and up the odds of survival.
Yeah, Kim and Devin, we've known for some time that regular exercise can lower the risk of many cancers, including breast cancer. Well, recent research also shows working out can help women fighting the disease and greatly reduce the chances of the cancer coming back. Kicking cancer one step at a time.
The magnitude of the benefit seen with increased activity was quite substantial, somewhere 40 to 50% chance of reducing the risk of the cancer coming back, and even greater degrees of reduction in death.
Cleveland Clinic Dr. Thomas Budd was one of the study's authors. The research looked at over 1,300 patients and their activity levels before diagnosis, during treatment, and at 1 and 2 year intervals after that. While it's known that exercising can be beneficial, researchers wanted to collect more evidence about how it could impact someone both before and after their cancer diagnosis. Researchers found doing something as simple as walking for a half an hour each day made a big difference. Dr. Budd says the data suggests it's never too late to start exercising, even if you've already been diagnosed with breast cancer.
Patients who did the worst were those who had very little physical activity. Another important finding was that patients who were inactive before treatment, but who became active a year later and 2 years later, also had decreases in recurrence of the breast cancer and death that were similar in size or magnitude to the patients who had greater degrees of activity.
Now, the research team plans to continue studying the science behind exercising and why it's helpful. The bottom line, getting regular physical activity really did make a difference.
That's really some good motivation. So I understand you also have an encouraging update in the battle against cervical cancer as well.
Yeah, I do. You know, a new study confirms the HPV vaccine significantly reduces the risk of cervical cancer. Now, previous research has shown the vaccine protects against HPV infection and other precancerous conditions. But for this study, Swedish scientists tracked nearly 1.7 million women and girls between the ages of 10 and 30 for 11 years. Those who were vaccinated before age 17 were 88% less likely to develop cervical cancer compared to their unvaccinated peers. And vaccination between 17 and 30 years old reduced the risk by half. Now, I know the HPV vaccine is probably one that many tweens might have missed getting during this pandemic, but I really strongly encourage parents to make that appointment and don't delay. Back to you.
Okay, Dr. McGeorge, we appreciate it.